Started. There's a nice group of you here today, so thank you so much. For those of you who have just recently hopped on, I encourage you to check the chat. I did drop some helpful information in there that you can reference throughout your presentation or your time at CSU. It will honestly just be really helpful even outside of this orientation process. But first, just want to say welcome to the university. My name is Abby Tynan. I use she, her pronouns, and I am the Associate Director of Communication for CSU Health Network. And we are every student's on-campus home for health and well-being at CSU. So today's presentation is going to be going over the services that are provided for you at the CSU Health Network. And I'm also going to talk about those new student requirements and recommendations like Bronwyn mentioned. So we have a lot to chat about today. I am going to ask that folks use the Q&A function here on the Zoom call. This will just be easy to monitor questions. There will be one little kind of fun quiz. And so for that one, you can use the chat so that way we don't clog up the Q&A, but just happy to answer any questions. So please ask anything that is on your mind. Again, everything that is covered in this presentation is listed on our website, which is health.colostate.edu, and that information is in the chat. So I encourage you to check that out. So I'm going to share my screen and then we'll get started here in a second. Okay, can everyone still see that okay? Bronwyn, are we good?
Yep, you're good.
Okay, excellent. For some reason, there we go. Okay, perfect. Okay, so if there's one thing that you can take away with you about the CSU Health Network, it's that you have access to all of our services regardless of your insurance plan. And that includes our medical, our mental health, and our health education and prevention services. And I'll talk a little bit about what health insurance looks like here in a couple slides. And we are truly here to support you. So we have over 200 providers and staff members that are experienced with and passionate about college healthcare. So just know that you're in really good hands when you come and see us. Our tagline is care for body and mind, and that's because we don't like to look at students as pieces and parts of themselves, but rather we know physical health and mental health are so largely intertwined that we like to take that integrated approach in caring for your student. Or in caring for you, excuse me. And unlike other, oh no, I don't know what just happened. I'm sorry. And unlike other colleges and universities across the country, we do have medical and mental health services all under one roof. And so we know that health and well-being is such a critically important part on your path to graduation. And so just know that we have the services that can help you succeed on that journey. So a little bit about who we are. So CSU Health Network offers medical services, mental health services, and health education and prevention services to all CSU students. And we're going to go over in the coming slides a little bit about each of these service areas. So let's talk first a little bit about our medical services. So these are broken into two main areas. We have our general and our specialty. Within our general medical services, we have what we call primary care. And so you can think about that just like a regular doctor's office. Maybe you need a checkup or you're just not feeling well. You can come in and access services in our primary care clinic. We also have a pharmacy on our first floor. So if at any point during your time at CSU, you need to take prescription medication, you can have that filled at the pharmacy on our first floor. And in addition, if you're already taking prescription medication, there could be an option to transfer that prescription as long as it's from another pharmacist in the United States. You could transfer that to our facility as well. Then on our second floor, we have our immunizations clinic. So our immunizations clinic is open to all CSU students. And so that's located on our second floor. And so CSU students can receive not only their flu shot or their updated COVID vaccine, but we can also provide some of the vaccinations as part of the new student requirements. So if you don't have your MMR or meningococcal vaccination, you could even get that directly at our facility. And then rounding out our general medical services, we also have our laboratory, we have radiology, and then behavioral health. But it's really our specialty medical services that set us apart from other college and university healthcare centers. We have a lot of services that could surprise people. So we have an allergy and asthma clinic on our second floor. So if you've ever been receiving allergy shots, you can continue to do so on campus. We even have a dentist on our third floor. So if at any point you need to get your teeth cleaned, you can do so right at CSU. Then on our second floor, we have an optometrist. So you can receive your annual eye exam at CSU Health Network. If you wear contacts, you can even pick up your contacts directly from us. And then if you wear glasses and you need new lenses in your glasses, we can write a new prescription for those lenses and you can have those filled out in the community. Then we also offer LGBTQ plus inclusive care, sexual and reproductive care, and so much more. And as I mentioned, you have access to all of these services regardless of your insurance plan. So CSU Health Network does bill insurance and we have contracts with most major insurance carriers. And so we'll talk again a little bit more about how insurance works here in a couple slides, but just know that anytime that you need to come and access our services, you'll just want to bring your CSU ID with you. And then if you have an insurance card, you'll want to bring that as well. And then we'll just bill your insurance company for any of the services that you received at CSU Health Network. Now let's talk a little bit about mental health services. So we are very proud of this culture of help seeking that has been embraced by CSU. This is all the way from the president's office to faculty, staff, and students. And so by paying your student fees, you get access to all of these services at no additional cost. And so that includes our crisis services, our groups, our workshops, brief individual therapy, and so much more. And we even have one of the largest groups and workshops programs among colleges and universities across the country, which is shy of 50 groups and workshops offered each semester. And there's even an international student support group, and we have specific services for international students. So I encourage you to check those out. So now let's talk about how to access mental health services. So similar to our medical services, these are broken into two main areas. Services where no screening or referral is required, meaning that you could just come and access those whenever you would like. And then there is another option where screening or referral is required. And so if for some reason you're interested in accessing brief individual counseling, therapy groups, or any of the other services listed in that screening or referral required section, the first thing for you to do is to come and see us during what we call our drop-in hours. So during our drop-in hours, you will come and meet with one of our on-call counselors, talk with them about your goals, your identities, your preferences, your areas of concern. And then that counselor will work with you to co-create what we call a wellness plan, or just kind of next steps that are a best fit for your need. So for some students, maybe it's brief individual counseling. Maybe for others, it's therapy groups. Or maybe you're even best served by a service in our no screening or referral required groups, such as our skill building workshops or our online 24/7 tools. So what we like to tell students is that it's never too early and it's never too late to seek the mental health support that you need. So please come and see us and get the support for you. So now moving on to our final two service areas, we have our health education and prevention services, otherwise known as HEPS, and then our business services. So within HEPS, we are very proud of the robust skill building programs and services that are offered. We have substance misuse prevention, mental health initiatives, all the way along the spectrum of stress reduction to suicide prevention. We have our peer education group called CRUISE. So that at any point, if you've heard Rams Take Care, Rams Take Action, that actually comes directly from our peer education team. They do a lot of really great work around bystander behavior, what it means to look out for your fellow Rams, and how to spot a student in distress. And then we also have well-being initiatives and sexual health initiatives. And then our business services is really just the internal arm of the CSU Health Network. So that deals with our student health insurance, our private insurance billing, our RAM Care supplement program, and our medical records. So some of you may have had the opportunity to see this building at some point at CSU. So this is the CSU Health and Medical Center. So we are located on the corner of College and Prospect, which is one of the main gateways to campus. And so this facility was built back in 2017, and it truly is state of the art. And we encourage you, whenever you are on campus, to just come and check it out. We have a really cool relaxation space on our first floor that is intentionally set up for prayer, meditation, and reflection. And it even has a nap pod. So if you're looking to take a nap for 30 minutes during the middle of your day between classes, you can come and access that space. So really just encourage you to come and check out our facility. As I mentioned, we are located on one of the corners of campus, so on College and Prospect. So I want to talk about a couple different ways that you can access our facility. So if you have a car at any point during your time at CSU, you can park in our patient and client parking lot for free during the duration of your visit. So we didn't want the cost of parking or the availability of parking to be a barrier to students accessing our services. So if you will have a car at any point, again, you can park in our lot during the time that you're at the CSU Health Network. Then I'll also point out Around the Horn. So Around the Horn is a campus busing system that has stops outside different academic buildings, residence halls, and they even have a stop near our facility as well. So maybe you don't feel like biking, longboarding, or walking to get to our facility. Around the Horn is a great way to reach us too. And then last, I'll talk about the MAX stop. So the MAX is a Fort Collins busing system that runs parallel to College Avenue, which is one of our main roads in Fort Collins. And CSU students can ride the MAX bus for free with their CSU ID. So it's actually a really great way just to get around our community. But in addition, it has a couple stops on campus, including a stop a couple hundred feet from our west entrance. So again, another good way for you to reach our facility. So let's talk about why CSU Health Network exists. We are truly here to support you. We want to help you with your medical and mental health needs so that you can succeed in college and in life. So we really want to help you get healthy, stay healthy. We know a new environment such as college can be a hard transition, so we want to help you adjust to this new environment. We can also help you solve problems. So please just come and see us for whatever support you may need. And now let's talk about when you can come and see us. So the CSU Health Network is open Monday through Friday, about 8 a.m. to 5 p.m. And we do have adjusted hours for university holiday breaks and closures, but any of that information will be updated on our website if for some reason we are not open. We also offer some after hours information that I have in a couple slides, so that way you can call us if you need help at night or on the weekends. And as I said, please don't wait. It's never too early or never too late to get the support you need, so please come and see us. So how can you come and access the CSU Health Network? There are a couple different ways. We definitely encourage you to call and make an appointment whenever you can. So you can call us at 970-491-7121 to make an appointment by the phone. But then we also offer some online scheduling for some limited appointment types. So you can visit our student health portal to learn more about how to schedule an online appointment. But say you wake up one morning and you're just really not feeling well and you feel like you need to see a doctor that same day, you can drop into our office between the hours of, I believe it's 8 to 3:30 for that drop-in care and be seen day of. So now let's talk a little bit about after hours and emergency care. So as I mentioned, CSU Health Network is open Monday through Friday, about 8 a.m. to 5 p.m. with those adjusted hours for university holiday breaks and closures. But of course, if you're sick and you're needing support, we encourage you to come and see us first. We are on campus and we do have a variety of medical and mental health services to help you. But what happens when CSU Health Network is closed? As I mentioned, we have that support by telephone. So there are 2 phone helplines that you can use when CSU Health Network is closed. We have our after hours nurse helpline and our mental health crisis intervention line. So at any point, if you're in a mental health crisis, please give us a call and we will get you the support that you need. In addition, I would really encourage you to use the after hours nurse helpline if you're ever not feeling well and CSU Health Network is closed. You can call that number and speak with one of our nurses, talk through your symptoms, how you're feeling, what you're experiencing, and then that nurse can help guide you in terms of like what steps are best appropriate. Maybe it's okay for you to wait until the morning when CSU Health Network is open, or maybe you need to go out into the community and seek urgent or emergent care. And if that's the case, there is a list of local urgent care and emergency room facilities listed on our website, health.colostate.edu. And I will say that emergency room care in the United States can be really expensive. So I definitely recommend you calling the nurse helpline and talking with someone, just in case for some reason you don't need to visit the emergency room. It will definitely save you some money there. But if for some reason there is an emergency and you're really not feeling well, and it's truly an emergency and it's very life-threatening, please call 911. That's really important. Don't wait to be seen. Call 911. There is care in the Fort Collins community near campus. So the Poudre Valley Hospital emergency room, that's the closest emergency room to campus. And then there's also another emergency facility a little further away from campus called Banner Fort Collins Medical Center. So just know that if you're ever in a life-threatening emergency, call 911 or visit the emergency room. And then here's a big question. How will you pay for these services? This can look a little bit different in the United States than maybe in your home country. So in the United States, your health insurance helps pay for medical services. So what you owe depends on your health insurance plan benefits. The one thing that's different though is that our counseling services, so your counseling fee will provide you access to our mental health services at no additional cost for you. So we will bill health insurance for our medical services, but our mental health services are covered by paying student fees. So now let's take a little quiz here. So I encourage you to use the chat function to answer these quizzes, the quiz questions, and we'll kind of see what happens here. So the first question here, what services are provided at the CSU Health Network? A, medical services, B, mental health services, C, health education and prevention services, or D, all of the above. Go ahead and drop your answers into the chat. Awesome, I see them all coming. Yep, D, that's great. So that is the correct answer. So medical, mental health, and health education and prevention services are provided at the CSU Health Network. So then our next question, oh, perfect. Question number 2. Do you have to be really upset to see a counselor? A, yes. B, no. C, they said no, but I think you do. So what is the answer to this one? Do you have to be really upset to see a counselor? All right, I see a lot of B's coming in. That's awesome. So the answer to this one is no, you do not have to be really upset to see one of our counselors. They are truly here to help you with your problems, whether they're big or small. So please come and see us. Okay, question number 3. What are reasons to come to medical services? A, bad sore throat. B, headaches. C, sickness. D, questions about women's health. Or E, all of the above. Awesome, I see so many E's flying in the chat. That's great. Yep, so anyone who put an E in there, that's totally correct. So it's all of the above. If you're not feeling well, you just have a questions, come and see us. We're located on the 2nd floor of the CSU Health and Medical Center. Okay, question number 4. Should you go to the hospital if you have a life-threatening illness? A, yes. B, no. Yep, tons of A's. Awesome. So yes, if you have a life-threatening illness or an emergency, please go to the hospital or call 911. Okay, question number 5. Who will we tell about your visit? A, your parents. B, your teachers. C, your friends. Or D, none of the above. Awesome. So for those of you who answered D, none of the above, that's correct. So the CSU Health Network and medical services in general in the United States are completely confidential. So we are not going to tell anyone about your visit unless you want us to. Okay, thank you for playing along with our quiz this morning. So hopefully that just reinforced a little bit about what we talked about. So now at this point, we're going to talk about our requirements and recommendations for new students. So the first one here is to submit immunization records. So, excuse me. As Bronwyn mentioned at the beginning of the presentation, I think some folks had questions about the deadline. So let's talk a little bit about our immunizations requirement here at CSU. So Colorado law does require every student to submit proof of the measles, mumps, and rubella, otherwise known as the MMR vaccinations. And then for students who are living in student housing, such as the residence halls, Colorado law also requires students to submit proof of the meningococcal vaccination given within the last 5 years. So that's kind of the key there. You must submit all of your official immunization records online through the CSU Student Health Portal. So we don't accept any paper copies. So we recommend that you scan a picture or take a picture with your phone or scan a copy of your immunization records, and then you can upload those directly to your student health portal. In addition, we do ask that your immunization records are in English. And so it's important to see if you can have those translated before you upload those records to the student health portal. The deadline to submit the immunization records is the first day of classes. So it's Monday, August 19th. So it's 2 weeks from today. And if for some reason you do not submit your immunization records by the first day of classes, you will end up having a hold put on your student account, and you will not be able to register for classes for second semester, so for spring semester, until the immunizations requirement is complete. But I do not want that to freak you out. Just know that we will work with you. So if for some reason you're still needing these immunizations, if you've never gotten them, please come and make an appointment at the CSU immunizations clinic. Just know that we're happy to help you. So please reach out to us if you need help throughout this immunization records process. So now let's talk through how you can submit those immunization records on our website. So this is a screenshot of our homepage, which is health.colostate.edu. And in this gray quick links tab, you'll see there's a student health portal button. So when you click that button, you'll be taken to this page, which is portal.health.colostate.edu. And here you'll log in with your e-name and password. So this is the same information that you'd use to log in to RamWeb, for example. And once you log in, you'll be taken to something that looks like this. So this is your landing page for your student health portal. So you can access any of the forms that you need to be seen at the Health Network, including the new student immunizations form, through the My Forms button on the main navigation. Some students may have this "You have pending forms" notification. So that can kind of be a good way to gauge, like, have you met these requirements or not? And then whenever you have a scanned copy or a picture of your immunization record, you can upload that directly through the document upload button in the main navigation. And say you upload your immunization records, give us about 2 weeks, and then you can log back onto the student health portal, and you will likely see something that looks like this. So for students who are compliant with the immunizations requirement, they will have this kind of like greenish blue box at the top. So in this example, this student is compliant, meaning they have met the immunizations requirement for the meningococcal vaccination. However, if you log back on and you have any information in a red box, that means you will have not met the requirement for whatever vaccination is listed. So in this example, this student has not met the requirement for the MMR vaccination, the measles, mumps, and rubella. So again, we just encourage you, after you submit your records, give us about 2 weeks and log back on to make sure, 1, that we've received them, and 2, that you have successfully met the requirement. Now we're going to watch a little video. It's just a couple minutes about just an overview of the US healthcare system. So I will click play and then we'll keep chatting.
The U.S. healthcare system offers some of the best medical care in the world, but it is complex, difficult to navigate, and often very expensive. The U.S. system will also likely be very different from the healthcare system you were used to back home. In this section of the video, we offer a few simple tips. First, like most Americans, You will need a private insurance plan, either through your school or one that you purchase directly. There is no universal access or national health care like many countries offer. When you seek any medical care, the provider you choose, hospital, doctor, or clinic, will look to you and to your insurance carrier to get paid for their services. There will be no payment from the government, and healthcare can be very expensive in the US. Here are a few recent real-life examples. Appendicitis, $60,493. Fractured humerus, $47,445. Fractured clavicle, $18,393. Car crash or serious illness, $150,000 plus. We hope by now it's clear why you need insurance. However, even with insurance, you should still be prepared to pay some portion of the cost of your medical care. Cost sharing is an important element of the US system, so medical care is never entirely free, and each time you access the system, you should expect some cost. While your insurance plan will typically cover the majority.
Hey, Abby. We lost sound, Abby. Abby, can you hear me?
For your plan.
Oh, there we go.
Hi, were you talking to me? I'm sorry, I couldn't hear you over the video.
We lost sound.
Oh, no. Okay,
Like
okay.
just 30 seconds ago.
Oh, okay, hold on. I actually may even pull up another video real quick, so hold on just a moment. That one would be better.
Welcome to CSU.
Okay, we're gonna try this again. I am sorry for the technical error on my end. This one is better anyway. Okay, can you see that?
Yes.
Okay, I'm gonna click play and then would you mind just dropping in the chat if you can hear me or not?
Yep.
Okay, thank you.
We are happy you are here. CSU Health Network is your home for health. We provide medical, mental health, and health education and prevention services to students. As a CSU student, you have access to all of our services. We know that accessing healthcare and using health insurance in the United States works differently than in your home country. This video will provide information about using health insurance in the United States and specifically how your CSU Student Health Insurance Plan, also known as SHIP, will work. In the United States, there is no universal health care, and people must purchase their own health plan to help pay for care when medical needs arise. Even so, when you visit a doctor, insurance will usually not cover all the costs. Most of the time, people will pay some amount when receiving health care. Because healthcare in the United States works differently than in other countries, it is important to define some common health insurance terms. A healthcare provider is a licensed medical professional or healthcare organization that provides medical services or treatments to patients. Deductible is a set amount of money you pay each plan year for covered healthcare services that you have received. Your health plan will begin to contribute toward the cost of care after the annual deductible has been met. Once the plan year deductible is met, you will still share in the cost of your medical care. This is when you may hear the terms coinsurance and copay. Coinsurance is a percent of the cost. You and your insurance plan will each pay a percent of the cost of care that you receive for medical services. A copay is the amount that you pay after your deductible has been met for a particular service each time you get that service. Now we'll talk about in-network and out-of-network care. In-network means that the health insurance carrier has a financial agreement or contract with a healthcare provider, such as a doctor or facility, such as the CSU Health Network. Out-of-network means that the provider or facility does not have contract or have a financial agreement with your health plan. Out-of-pocket maximum is the most you will pay for covered healthcare during a plan year. Once the out-of-pocket maximum has been met for the plan year, you will not owe anything more for covered healthcare during that plan year. Plan year is a 12-month period of time during which deductibles, coinsurance, and copays accumulate toward the out-of-pocket maximum. CSU SHIP's plan year is August 1st to July 31st. Out-of-pocket costs are your expenses for medical care that are not covered by your health plan, including the deductible, coinsurance, copays, or non-covered services. For CSU SHIP, international students have a $500 plan year deductible when medical services are received outside of the CSU Health Network with in-network providers. There is no deductible to meet when you receive your medical care at the CSU Health Network. When you receive medical care at the CSU Health Network using SHIP, there are no co-insurance or copays, and medical care is covered at 100%. When you use an in-network provider, you will pay a smaller deductible, $500, and coinsurance, 20%. When you use a healthcare provider or facility that is out of network, you will pay a larger deductible, $1,000 instead of $500, and a greater percentage of the cost, 40% instead of 20%. Because healthcare in the US can be costly, it is most cost-effective for students on the CSU Student Health Insurance Plan to start their care at CSU Health Network if possible. You can think of CSU Health Network as your on-campus doctor's office. When you access medical or mental health care at CSU Health Network using your SHIP insurance, most, if not all, of your care is covered with no out-of-pocket costs. This is because for students with SHIP, the deductible does not apply for services received at CSU Health Network. CSU Health Network offers a variety of general and specialty medical services, including dental, vision, immunizations, primary care, pharmacy, physical therapy, and more. To learn about all of the services at CSU Health Network, visit health.colostate.edu. Your CSU Student Health Insurance Plan is also in network with many providers and facilities in Colorado and the United States to make it convenient to find care at the lowest cost. When healthcare services are received outside of CSU Health Network, students enrolled in the CSU Student Health Insurance Plan will have a deductible to meet and then either coinsurance or copays depending on the service received. Specific details about what you can expect to pay under the Student Health Insurance Plan can be found at health.colostate.edu/international-SHIP. As you learned earlier in this video, we encourage you to visit in-network providers whenever possible. If you are looking to find an in-network provider off campus, staff at CSU Health Network or your health plan customer service department can help you. Once enrolled in the Student Health Insurance Plan, you should carry your insurance ID card. It can be downloaded to your phone or computer, and you can find instructions on how to download your insurance card at health.colostate.edu/international-SHIP under the Quick Links section. You should show your health insurance ID card when receiving healthcare so that the healthcare provider can bill your insurance. The insurance ID card also has the insurance customer service phone number on the back if you have questions about healthcare services or providers outside of CSU Health Network. If CSU Health Network is closed or you have an urgent or emergent need, you should seek care at a local urgent care or emergency room. Be sure to bring your insurance ID card. If CSU Health Network is closed and it is not an emergency, the CSU Student Health Insurance Plan also offers online, no-cost medical or mental health appointments 24 hours a day, 7 days a week. More information on accessing online care can be found at health.colostate.edu/international-shift. If you have questions about the CSU Student Health Insurance Plan, please call 970-491-2457 or email chuhn_insurance@colostate.edu. Thank you for watching the video.
Okay. Thanks again for bearing with me during that, and I'm glad we switched to video. Oops. So this does bring me to the health insurance requirement. So this is required for all international students, and all international students are automatically enrolled in the student health insurance plan, which that video talked a little bit about. You are billed for the cost of the student health insurance plan after you register for classes, and there is the option to opt out through a waiver process if you can show proof of acceptable private health insurance coverage. If you do have other insurance coverage, we do ask you to submit a waiver request form and a copy of your current insurance policy to the Student Health Insurance Office. And the deadline to do so is Wednesday, September 4th. So it's a couple weeks into the start of the semester. It's actually the university ad drop date. Most accepted waivers include most employer group health plans, approved sponsor plans, or individual plans that meet healthcare reform law. Non-accepted waivers are short-term plans such as international student plans, foreign plans, or individual plans that do not meet healthcare reform law. And I truly encourage you, if you have questions about health insurance, please call us or please stop by and chat with us. Our student health insurance team is so knowledgeable and is happy to answer any questions that you may have throughout this process. So this brings me to our couple final requirements here. So there are two required modules for all incoming CSU students. And so these are alcohol EDU and sexual assault prevention. So alcohol EDU provides personalized feedback that encourages students to consider their own drinking decisions and those of their peers. And sexual assault prevention educates students on issues associated with stalking, interpersonal violence, and sexual assault. And so your access to these programs began at the end of July. So you should have already begun receiving emails to your colostate.edu email address, alerting you that these programs are open and available to take. The deadline to complete these programs is the first day of classes, so Monday, August 19th. And similar to our immunizations requirement, if you do not complete the 2 required online modules by the first day of classes, you'll have a hold put on your student account and you will not be able to register for spring semester classes until both alcohol EDU and sexual assault prevention are complete. And you can access both of these modules online through your RamWeb account. And then this is just our final kind of recommendation here. It's to create your You at CSU profile. So You at CSU is our online student success portal that connects you to confidential, customized feedback to help you meet your goals or address your concerns in 3 areas: succeed, thrive, and matter. So You at CSU is really cool because it will connect you to personalized on-campus and online resources. So this is a screenshot of You at CSU. So say you typed in stress in the search bar. Up would pop a variety of content cards related to stress. Some of them may have a Ram's head on them, meaning that those content cards are specific to something that's offered at the university. So maybe it's our mindfully managing stress workshop or another group or workshop through counseling. Contact cards that do not have ram's heads on them mean that they just might be an article about 10 tips for stress management or a video on breathing techniques for how to manage stress. So we're just encouraging students to log on and create their U at CSU profile before coming to campus or even before classes start, just so that way you can begin to explore all of the great resources that the university has to offer you. So at this point, that wraps up my presentation. I know we went over a lot today, talking about all of the services at the health network. We talked about the new student requirements, health insurance. And so I do see some questions in the Q&A. So I'm going to get to those now and I'll do my best to answer them. And if I, for some reason, can't answer your question, I'll at least be able to direct you to someone who could help you. So the first question here is, are CSU Health services available to a student's dependent? And the answer to that is unfortunately no. CSU Health Network services are only available to CSU students. So we do not provide care to student dependents. So you would have to go and seek care out in the community. The next question here. Can I use health resources with health insurance that's not CSU's health insurance? So the answer to that is yes. So if you have your own private insurance or again, a sponsor plan or another type of health insurance that meets the requirements for the university health insurance requirement, we can certainly bill your private insurance for the services that you access at the health network. So you can definitely use other insurance here. The next question here is, can I get braces with the student health insurance? And so the answer to that is no. So the student health insurance plan does offer some dental benefits, but it's generally for dental cleanings or fillings or kind of those procedures and not what we would call orthodontics, which would be braces. So unfortunately, the answer to that one is no. So this is a great question and something that I was planning to share during this Q&A anyway. So I did notice that there was a piece of outdated content in the video that was shared. So the video that was shared said that there would be no copays at the health network, and that is not true for this year. So we are implementing minimal copays this year for students on the student health insurance plan. And there is information about that on our website, health.colostate.edu/international ship. So if you have heard that this year we will be charging copays, that is correct. And I am happy to share the link to the video. So just a moment. And again, just a note that for that video, like I mentioned, the information about the copays is incorrect. So there's the link to the video. Okay, so this person says, I only see the MMR vaccination as green marked, and I'm assuming you're probably in your individual health portal, but nothing else. So that's correct. So unless you're living in student housing, such as the dorms or the residence halls, the MMR would be the only vaccine that's required. So for some of you, it might be that the MMR is the only required vaccination. Students who are living in the residence halls would then also be required to submit the meningococcal vaccination. So it is, so if you're not living in student housing, you would only have to worry about that MMR vaccination. So in this instance, it looks like you would probably be good to go. And I would assume that you're not living in the residence halls. Yes, this is a really great question here. How can we get the health insurance card? So let me pull up the link so that way I can show you how to access that here. So there's information on our website about how to access your health insurance card. We encourage you to download this app called Sydney Health. You can view and use your insurance card directly on there. So I will type the link to this and I will send it, and hopefully folks can see that link dropped in the Q&A. Okay, so this next question is, how can I check my current status of my CSU health insurance and what plans I'm on? So that's a good question. I might need some more information on this one, but what I would say is that all international students are automatically enrolled in the student health insurance plan. So you are so unless you have completed the waiver, you're already on that student health insurance plan. But I would encourage you to reach out to our to our student health insurance office, and I'll drop that information in the chat here for a second, so that way you know how to reach out and confirm your coverage. Just 1 second, I'll drop that in the chat. Okay. So this person has not received any emails regarding alcohol EDU. So I believe if you're over the age of 23, then alcohol EDU would not be required. So if anyone is over the age of 23 and you have not received any emails regarding alcohol EDU, that's probably likely why. Okay. Can international students seek medical services before the semester begins if they have registered for courses? This is a great question. So your access to our services actually begins the week before classes start. So 1 week from today, Monday, August 12th, you can begin accessing our services. So we encourage you to come and see us. There's also the ability for you to make a transfer of care appointment. So you could even call today to make an appointment for next week. I'll type in here so you can call. Okay, you can see that. So for students who are interested in making an appointment, you can call at any point this week to make an appointment for sometime next week. So will SHIP cover the cost of immunizations if I decide to take proof of immunity test or MMR vaccine from the health network when I get to campus? So the student health insurance plan does cover the cost for those incoming new student immunizations. I am not sure if it will cover a proof of immunity test. So if you end up receiving the vaccine itself, that is a covered benefit under SHIP, but I'm not sure about the proof of immunity test. So in that case, I would recommend you calling our health insurance office or emailing that email address that I put in the chat just to confirm about the immunity test, but they will definitely cover the cost of the MMR vaccine. Okay, another question about how to receive the health insurance card. I will drop that back in the chat again. Just a second. Okay. Yeah, so this question is, how do I create a U at CSU profile? Is it the same as a CSU Net ID? So they are actually, you can access U at CSU directly through your RamWeb account. So if you log into RamWeb using your CSU Net ID, there should be a link to U at CSU from RamWeb, and then you can go on and answer the questions about that it's asking you to create your profile, and then you should be good to go. So you can access U at CSU through using your Net ID on RamWeb. Good. Another question, is it mandatory for graduate students to complete the alcohol EDU? So again, I believe the age is 23. That's the cutoff for alcohol EDU. So if you are under the age of 23 and you're a graduate student, then yes, you would still need to complete alcohol EDU. Okay, saw on the ISSS pre-arrival PDF, it says about completing a tuberculosis check form and sorting out health history. Is there stuff I need to bring, or is this done during orientation? Yeah, that's a really great question. So the tuberculosis check and the health history form are both things that are recommended, but they're not required. So both the tuberculosis assessment and the health history form can be accessed online through your student health portal. And the URL for that, I will type it in the chat right here, is portal.health.colostate.edu. And you can access the tuberculosis assessment and health history forms through the student health portal. So if you are interested in completing those, please log on to the student health portal and complete them. So thank you so much for asking that question. And the information is in the chat. Yes, this is a great question. It says, hi, I'm a returning student. Do I have to resubmit my vaccination card and take the alcohol EDU again? So I'm going to say likely no, you do not need to resubmit your vaccination card. But to be honest with you, I am not positive. So what I would do for that, because I don't want to give you the wrong information. So for the student who is asking about resubmitting vaccinations, I would encourage you. I'm trying to find the information for you, just a moment. I would encourage you to call us and ask to speak to one of our immunizations nurses. And so I'll type the answer in here. So call. And then in terms of alcohol EDU, if you have already completed that at CSU, you should be good to go, but I am going to give you an email address to email to confirm, just to double check that.
And Abby, we do have 2 students that have their hands raised.
Oh, okay, I'm sorry, I haven't seen that. I've been
Do you
logging,
want to
doing
let
different
them
things.
unmute themselves?
Yeah, that's great. Please do. Thank you.
So I'm going to start with the first one. So if you have a question, I just allowed you to unmute yourself. We'll see. So Ziad or Nee, you are able to unmute yourselves if you would like to ask your question. Otherwise, you can put them in the Q&A.
I'm not hearing anything, so I have 2 more questions in the Q&A that I'll answer, and then I'll give you time if you want to unmute yourself here in a moment. The question here is, what if I did not receive an email link regarding alcohol EDU? Can I share the link? So unfortunately, I don't have access to those email links. So if you did not receive a link, I would encourage you to email alcoholedu@colostate.edu. I'm going to put this in the chat or in the Q&A as the answer to your question. So I would just encourage you to email that email address and just confirm, and they can help you. Okay, so this next question is, do we pay as a lump sum for health insurance along with our first semester fees for the duration of 1 year, August through July? So I believe those are billed per semester because our premiums, we have a fall semester premium and then a spring premium, and that spring premium covers you through the summer as well. So I think you are likely billed for the fall semester during the fall, and then you'll bill for the spring and summer in the spring. So if you have questions about what that billing looks like, I will drop information again, and you can ask that question in terms of what the student health insurance billing is. Just a moment. And if anyone wants to unmute while I'm typing and ask a question, please do.
Yeah, I have a question.
Sure.
So I just graduated like last semester from CSU,
Yeah.
and I have I'm doing my master this semester. So do you have to do the alcoholic courses and other things?
I think you should be good to go, especially because you've already graduated from the university. So I think you should be set. Have you received any emails about alcohol EDU then?
No, I didn't receive anything, but like I received that I have to join the Zoom.
Oh, sure.
And
Yeah, I would say if you haven't received any emails for alcohol EDU, knowing that you've already been a CSU student and you're continuing here, you should be just fine.
I see that. Okay.
Yeah,
Thanks so much.
You're welcome. Thank you for your question. Any other questions that someone would like to unmute themselves and ask? Okay. So there are a couple more questions in the Q&A, so we'll get to those. And again, I'll allow the opportunity for you to unmute again here in a moment. This next question is, can I have a comprehensive body examination at the clinic? So yes, you certainly can. So we would basically call that kind of like your annual checkup or your annual wellness exam. And so that is certainly an option, and we would encourage you to call and schedule your annual wellness exam. So the answer to that is yes.
There's a question in the chat that just asks if the health insurance will automatically be put onto the CSU student account, or do they have to register? And then they also ask when the due date is to pay for SHIP.
Yeah, great question. So for international students, the health insurance, you are automatically registered. So you do not have to worry about registering for SHIP. That will be a process that's already in place since you're an international student. I am unsure of the due date for when you have to pay for SHIP. So it looks like Greta asked this question. So for Greta, I would encourage you to email CSUHN and I'm dropping this in the chat right now, CSUHN_insurance@colostate.edu and ask when the due date is to pay for SHIP. I know that the deadline for other students who have to actively enroll in that is September 4th. So I would assume that the payments for that wouldn't start until early or mid-September. But I would definitely encourage you to email that address that I just dropped in the chat, and you can confirm when payment for that is due. I'm going to answer the one in the Q&A, and then I'll go to and you're welcome, Greta, and then I'll go to the one in the chat. So the one in the Q&A says, will I be required to present any immunization records or medical tests at the airport? So that I'm actually not sure how that works. I don't know, Bronwyn, if you have any idea. I can only speak to the requirements at CSU Health Network or the university. I'm not sure what that looks like at the airport.
Yeah, I don't believe that is something that they will ask you for at the airport. They will ask to see your I-20, your visa, passport, things like that. I do not believe they'll ask about your health insurance information.
Okay, so then the other question that is now in the chat is, how do I know that everything is okay with the tuberculosis exam that I sent? So I'm gonna assume that you're referring to the tuberculosis screening that's on the CSU Student Health Portal. If for some reason there is something that our nurses will want to follow up with, they will likely contact you directly. So if you haven't heard anything, I would assume that you are okay. So anyone else that would like to unmute themselves and ask a question? Great. Okay, final calls like, oh, okay.
There are a few more in the Q&A.
Hi, is uploading the proof of immunization record mean just uploading the proof of the required vaccination, or do I need to upload the doctor prescription? I'm an international student. So when you're uploading your immunization records, basically you are uploading proof that you have received the required vaccination. So that is basically what that means. So I hope I've answered your question. If not, feel free to unmute yourself or drop another question into the chat or the Q&A. But as long as you are providing proof that you've received those immunizations, you should be good to go. Okay, next question. I'm an international student with little kid as my dependent. Since CSU does not provide insurance for my dependents, how can I get help or advice on how to buy suitable insurance for a dependent kid? I used to buy international visitors insurance, but the coverage is very limited and not enough for a growing kid. Any advice? Yeah, sure. I actually would still encourage you to come and chat with our student health insurance office, only because in that office, we also have specialists who work in the private insurance realm. And so they might be able to help you navigate the health insurance system, or at least make recommendations for what you can do for your dependent child. So I would give us a call or stop in. Our health insurance office is on the second floor of the CSU Health Network in our business services suite. So please just come and chat with us, and we're happy to try and help guide you in terms of finding insurance for your dependent kid. Thank you for your question. Okay, another one. For graduate assistantship recipients, do we need to opt for the SHIP waiver? According to what's published on the website, graduate assistantship receive a waiver for the SHIP program. So what I'm understanding for that is that when you're a graduate student, they cover the cost of SHIP, meaning that you won't pay for SHIP because you're a graduate assistant. You do not want to waive SHIP, because if you waive SHIP, that means you will not have coverage under the student health insurance. So what this basically means is that you will be enrolled in the student health insurance plan, but instead of you paying for that, your graduate assistantship will be paying for that. So please do not go on and waive the health insurance through us. And if you do have questions regarding basically, I think what they call a stipend for the health insurance, that's something that you will actually want to ask your graduate program about. They deal with all of the stipends and all of that. We don't actually deal with kind of that benefit. So if you have questions about the graduate student contribution for your health insurance, please reach out to your graduate program. Okay. I'm not currently seeing anything else in the Q&A or anything else in the chat. So we'll do kind of one final call if anyone wants to unmute themselves and ask a question. Hey, another Q&A. I do believe that this has been recorded. Bronwyn, is that correct?
Yes.
Yes, it has been. Any final questions? Okay. What I'm going to do is I'm going to drop my email into the chat. So if anything comes up afterwards, you are welcome to email me, and I'm happy to provide an answer or direct you to someone that could actually help you. So I just dropped my email in. Please reach out, and just know that we are here to support you regardless of what your needs are. So if you're needing help for your mental health or your physical health, please reach out to us. And then Bronwyn, it looks like folks are just wondering how they're going to get access to the recording.
So we will post it on our orientation page, and we'll also send it out to students.
Awesome. Well, thank you all so much for your time. Again, come and see us, and welcome to CSU, and wishing you a healthy fall semester. So thank you so much.
Thank you, everyone. Thank you, Abby.